Good morning, Facebook. This is Megan Rogers with Indiana Ship, and I am joined this morning with my wonderful co-host, Susan Spilly. Good morning, Susan.
Good morning, Megan. Happy Easter Monday, everyone.
Yes, yes. Happy Easter Monday. I hope everyone had a great Easter, no matter how you celebrated it. But we are here with our first April Facebook Live. Susan has some wonderful information for us on COBRA and Medicare. You may have seen some of our other Facebook Lives where we talk about other secondary options with Medicare, employer insurance, retiree, Medicaid, VA, COBRA, and some of those work with Medicare and some don't. So Susan is going to educate us on COBRA and how it does or doesn't work with Medicare. Feel free to chat in your questions as we go along, and I will be monitoring that chat box. Our lives do stay posted on Facebook for about 30 days after the live. So if you're watching the recording, feel free to still chat in. Susan and I monitor those chats even after we're done with the live. So once we see it, we'll respond to your question as soon as possible. Susan, what or how should I say, does COBRA work with Medicare?
Okay, well, first of all, we're going to talk about just some general COBRA stuff. A lot of people think that COBRA is actual insurance, like I have COBRA insurance, but it is actually, was enacted in 1985, and it stands for the Consolidated Omnibus Budget Reconciliation Act. So that is COBRA, COBRA. It's not a health plan. It's not insurance from the government. It's a law because it was an act that was voted on and passed by our nation's legislature. The U.S. Department of Labor and Treasury have jurisdiction over it, and the IRS is involved too, no surprise there, under the U.S. Department of Treasury, and they publish the regulations, eligibility information, and other provisions. So it's been around for quite some time. And if you um, have a federal government sponsored insurance, COBRA may not apply to you. It also doesn't apply to church owned organizations who have their own self-insurance. And you don't get any COBRA rights if your business goes out of business. If your former employer closes shop and they no longer exist, then your COBRA rights no longer exist. The benefits you get under the COBRA provision in the law applies to the primary insured person and their dependents. And you have to be offered the same coverage you had when you were an active employer. This includes things like the same deductibles, the same coinsurance or copays, and limits on coverage. So you get the good and the bad there. Employer companies generally send you information about your COBRA rights in about a month after you have discharged. Some send it sooner, but they do usually have around 45 days to send you your coverage information. And this is basically giving you your choice. Do you want to use your COBRA rights and continue your insurance like you had when you were an active employer? Or do you want to just say, no, thank you, I have other insurance? Maybe you got another job during that time and you had insurance available through that job immediately, or maybe you become a dependent on somebody else's coverage. Or you decide just to pick up your Medicare benefits if you're a Medicare eligible person. Generally speaking, your enrollment use in your former insurance, your re-enrollment in your former insurance does go through your HR department, your former HR department. And many times you are paying that premium to your former employer, although you can pay it, and I know I've had personal experience paying it directly to the insurance company. Oops, sorry. Now, here's one issue with COBRA. Because many employees don't realize how much the true cost of their insurance has been while they've been an employee. And when you get the cost, the bill information about your COBRA coverage, remember, COBRA is not insurance, COBRAs are right. So it's saying, well, here's the cost of the insurance. And that cost is what's been paid. Maybe you've paid part of that insurance as an employee, but your company had been paying probably the lion's share of it. So sometimes this is a big shocker to folks. Also added on is this 2% administration fee. I guess there's probably extra work involved when you are insuring a non-employee. Generally speaking, we think of COBRA rights existing for 18 months after you've separated from your company and rejoin their employee-based plan. However, there are various levels of coverage and different times when you can have COBRA, when you can use your COBRA rights. The law limits those, but your employer, if they're super generous, may extend your benefits past the COBRA rights. And we're going to look at a chart that shows you if you're this, then you have this many months of COBRA rights. If you receive Social Security disability income, and your disability began before your COBRA event, which means your separation from your company's insurance, or within 60 days of the beginning of your COBRA rights, you can have those rights for 29 months. So this is an extension of that 18-month period by an extra 11 months. Once you receive your disability determination, you have to give the plan notice within 60 days of you receiving that determination. After the average or normal coverage period of that 18 months, your premium may increase to even more than what you and your former employer were paying for that plan. And that would remain your cost for the 11 months that you get extra. Here's our chart that shows us different levels, different kinds of coverage for different groups of folks and how long the coverage lasts. Now, a thing with COBRA is whatever you have as an active working employer is what you have rights to continue after you separate from that employer. So if all you have is dental insurance with your current employer, that's the only right you will have. You can't go back and say, oh, I want the medical, I want the optical. So that's something to consider. It's basically a continuation of your coverage for which you will pay the 100%, or in the SSDI folks, 150% if they extend it past 18 months. But it has got to be the same coverage. So if you terminate your employment or you receive a reduction of work hours that makes you ineligible for insurance benefits at your work, you can cover your employee, your spouse, and dependent child, and you get 18 months of COBRA rights. If you're a person who enrolls in Medicare, Parts A or B, and you are an employee or a spouse or a dependent child, then you do get 36 months of COBRA rights. Now, let's remember that COBRA is going to be a lot more expensive for almost everyone because you're paying your part and you're paying your employer's part. If the employee or former employee dies, there's a divorce or legal separation, the spouse and dependent child, if they were covered during active employment, get 36 months of COBRA rights. If your dependent child loses that status, then they can get 36 months of COBRA rights. When we're talking about Medicare and being able to enroll in Medicare with no penalty, purchase additional insurance like enroll in an Advantage plan or purchase a drug plan or purchase a supplement plan, we always use the term actively working. because there are three criteria which pretty much give you the freedom to sign up for Medicare and elect additional or purchase additional benefits. And that's being an actively working person for a large employer, and you have creditable drug and you have the health insurance. And when you're on COBRA, you're not actively working, right? Because you've left your employer, so that you no longer have access as an actively working person. So if you delay accepting your Medicare, assuming you're eligible for it, and we start receiving COBRA benefits, if you wait too long, past 63 days, then you may come into some trouble buying the insurance that you want to buy after you are eligible for Medicare. Generally speaking, and I've yet to meet a person for whom this is not accurate, Medicare and purchasing additional insurance like a supplement plan, drug plan, or an Advantage plan is almost always much cheaper than using your COBRA rights and paying that big whopping policy money every month. But SHIP counselors can help you look at that, and we can talk to you about Medicare costs and coverage and even get you some really solid estimates so you can compare what your COBRA coverage is and how much it costs to Medicare and extra insurance that you may buy and how much that costs and how that works. Now, your COBRA rights will end when you reach your limit of coverage months, whether that's 18 months or 36 months. And of course, like most insurance, they'll drop you like a hot rock if you don't pay your premiums. Another way that COBRA can end is that the employer stops offering that insurance or they go out of business. Your COBRA rights end if you get another job or otherwise have access to full or equivalent coverage. That can be as a dependent, maybe. It can be as the primary person, or when your Medicare A and B become effective. There's some little details, always are. If your employer has 20 or more employees on at least half of the working days in the calendar year previous, the coverage must be in the health plan. You must be in the health plan on the day before that qualifying event. That qualifying event really means your separation from your employer and your inability to continue on as an actively working person under their employer group plan. Now, if you are the primary person that's been insured, your spouse or your dependent can continue coverage even if you drop out of it. But remember the cost. I'll say it again, remember the cost. And remember that qualifying event is something specific that happens that causes you to lose your employer group health plan. If your employer has less than 20 employees, there may be rights to an individual insurance policy from that company. That company may offer you something special if it's a small employer, but you have to request that conversion policy within 30 days of your employer group plan ending. That is COBRA 101. Um, Here's a slide that shows how you can reach Indiana SHIP. And remember, we are experts in Medicare, and we can share with you what Medicare costs, help you look at supplement plans, help you look at drug plans, help you look at Advantage plans, and help you look at those costs. And that's one really important way that you can compare what Medicare is and what it does and how much it costs to potential COBRA coverage under your COBRA rights. And then you can make the decision that's best for you and your family. Regarding Medicare, there are programs that help you pay for your premiums, copays, and deductibles. SHIP counselors are well aware of those programs, and we can even help you do the applications. So give us a call at our call center, or you can visit us on the web, medicare.in.gov.
Thank you, Susan. That was a wonderful presentation. Um, Do you want to? Okay, thank you. We don't have any questions. I think you covered it all. And like Susan said, we are experts in Medicare, so we can help you compare your COBRA with Medicare to determine what's better as far as costs and coverage or what the coverage is. But make sure when you do meet with a ship counselor, you are aware of all your COBRA coverage, what it covers, what it doesn't cover, the premiums, because that will help us help you in your decision. So, uh, what do we have coming up? So, we have a lot of webinars coming up. Our Lunch and Learn for April is home health care. That's this Thursday at 12 o'clock Eastern. And then we're continuing to cover what other options you have when it comes to home care, hospice, or nursing home. So that will be our second quarter 2026 Facebook Live topics. And what else do we have coming up for our standard Facebook Lives? We will be back on Wednesday at 10 o'clock to talk about insurance agents, what they are allowed to do, and what they are not allowed to do, set by Centers for Medicare and Medicaid Services. And then we're going to wrap up the month on the 20th, and we're going to talk about how to make sure your Advantage plan works for you. So we're going to talk about some of the positives and the negatives of Advantage plans and tips and tricks to make sure that you have the coverage you think you have. And then I'll do a quick plug. Our next new to Medicare webinar is in June. I don't remember the exact date and I didn't pull that up, but it is on our Facebook page as an event. You do have to register through Eventbrite, and it will be a Thursday evening at 6 p.m. Eastern.
I think it's either the 18th or 19th, kind of
See,
like
that's what
last
I thought
year's.
too, but then I
Mhm.
doubted my brain because that's what March was, and I'm like, well, is it the same? So thank you, Susan. We're
Yeah.
around that time, 18th, 19th, but again, the date will be on Facebook for our event page for that. But again, that is not a Facebook Live. You do have to go to the link in that event on Facebook to register through Eventbrite, and then you'll get the Zoom link. All right. Well, without further ado, we will say bye for this Easter Monday, but we will be back on Wednesday and Thursday this week. Bye, everyone.